It's a pleasure to be here. Thank you, everyone. Thank you, Dance USA, for having us. I love this stuff. I love talking about it. It's here, right? The Affordable Care Act is here. And what does it mean for your small business? We'll go ahead and get started. So, Small Business Majority is a nationwide nonprofit. We do research and advocacy and education, really, on the issues that are of most importance to small business owners. So access to capital, tax reform, clean energy, and then, boom, healthcare, which is a lot of the work we do here in the Northeast. I'm the Northeast Outreach Manager, so our office is in New York, but then I cover New Jersey, Connecticut, Rhode Island, up to Maine. So we do these all over the Northeast. And then we have offices in DC, where our headquarters is, going east, Ohio, Missouri, Denver, all up and down California, north and south. And we really want, our mission is to be that resource for small business owners. So if I go fast and you go home today, you say, oh, I forgot to ask him this question, go to www.smallbusinessmajority.org, which will be up here at the end of the presentation. And every single question you have can be answered there. And if I can't answer your question, our team is experts. They live and breathe healthcare. So I'll make sure to find someone that can. So that's who we are. What's the number one thing that comes to your mind when you talk to a small business owner about healthcare? Cost, the money. I see this guy over here. Yeah, the money. Yeah, that's exactly right. And with the status quo, we saw that about 28% of the self-employed were uninsured. Small business owners were paying 18% more for the same exact plan that their large business competitors were paying for. That was with the status quo before health reform. That's ridiculous. I mean, it's just appalling to me. So a broker goes to a business with 500 employees, right? It's easy for them to say, okay, here's a policy. But when they show up to a nonprofit or a small business that has 3 employees and that risk isn't pooled around 500 people, that's that's more money. And so that's where we were. Again, Sarah gave you a great job on the background, so I'll breeze through this slide. If you have any questions, please stop me. This is a real informal session. This is what we have now. Healthcare reform is here. It was actually upheld by the Supreme Court in 2012, which don't care what party you affiliate with, but it was upheld by a Republican-dominated Supreme Court. And the implementation, as she touched on, is primarily the responsibility of the states. She did a great job of explaining, you have the federal government exchanges, or you may be in a state that has your own state marketplaces, where we're seeing enrollment numbers are a lot higher than in the federal marketplace. So I think this trend of what we'll see is states will start to shift towards state-based exchanges. I work a lot in Connecticut, and they've actually been approached by other states saying, hey, can we use your marketplace? Can we use the model? Because Connecticut's actually got a lot of folks signed up, as well as Kentucky, Washington State, which is my home, where I'm from. So that's kind of the trend I think we'll see. Why does it matter to you? Well, most Americans, as she touched on, will be required to have health insurance, not news to you. But as small business owners, you're really the lifeline of the community, right? Especially the owners of the business. You have 5, 10, whatever, 1 employee. They're going to come to you with their questions on healthcare. So if you're not informed, there's going to be a disconnect there. So that's our mission, is to get the small businesses, more knowledgeable about what's happening. So as Sarah touched on, we do see some immediate consumer protections, and I'm going to be pounding a lot of what she said in your head, because that's how it got into my head. So number one, we're seeing you can no longer deny coverage for patients with pre-existing conditions. We're seeing a ban on lifetime cats that sets limits on coverage. And that big one she mentioned, adult children, adults, whatever you want to call them, under 26 can stay on their parents' plan. Another thing that she didn't mention is that it doesn't matter if they're in college, if they're financially dependent on you, if they're not living with you, they can still claim their parents' insurance. So that's important to know. Again, folks can't drop coverage because an employee or an employer say they made a mistake on their paperwork. That no longer is going to prevent you from receiving health care. And more access to community health centers as well throughout the nation. They got a lot of funding from the ACA. Well, I shouldn't say a lot. There should have been more. But they got a lot of funding from the ACA. So these community health centers are nationwide, and that's a great place for folks to receive access to this care. So what now for the individuals she touched on and the self-employed? There's a lot of folks that own and run their own business. They're one person, right? So individuals can purchase for themselves, their families, on the individual exchange. Remember, there's an individual exchange over here, and then a shop, the small business marketplace over here. Important to keep in mind. So the plans, as she told you, will be organized by medal level. I was thinking the Olympics, bronze up to platinum. Some states offer platinum level now, some states don't. And then at the very bottom, there's that catastrophic plan for adults over 30 in most states. It depends on where you are. And again, the plans represent the percent of the health costs that will be covered. So 60% for bronze, 70 silver, 80 and up to platinum. And then all plans have the same set of essential health benefits. I'll give you a couple of those. So ambulatory, patient services, maternity, newborn care, behavioral health treatment, and prescription drugs comprise that category of 10. So keeping costs low, right? That's a mission of the Affordable Care Act. So if most will be eligible for some financial assistance on the marketplaces. Sarah did a great job of pointing out, financial assistance will be on a sliding scale. If your household income is between 100% to 400% of the poverty level, some low-income families will be eligible for cost-sharing reductions. I'm going to kind of breeze through this individual marketplace stuff because we're here for the small business piece. So if you have any questions, just slow me down, ask me. Here's an example. It always helps me to look at an example. So a family of 4 with 2 45-year-old adults, that's 2 children under 20, they make about $80,000 a year. The new marketplaces on the individual exchange, an unsubsidized insurance premium silver plan through the individual marketplace would cost them about $12,549 a year, or $1,045 a month. So they would be eligible for premium assistance because they're at 340% of the federal poverty level. That's a $4,949 tax credit, or $412 per month.
So quick question, because this is a process that I've been going through.
Yeah.
With the tax credit, so when I was looking at small business health plans for my company,
Yeah.
we looked at plans that were in the group, the small business marketplace. And we also looked at small group plans directly through the insurance companies. So, and what we found was that, for instance, the Oxford small group plan that you get directly through Oxford is notably superior to that which you get through the exchange. So the question I have is, how do the tax credits actually get? Obviously, you don't get the upfront tax credits.
No.
If you don't go through the exchange, but do you get them on the back end?
Yes. So this is a great question. I'm glad you brought that up. One thing to start off is that you don't have to shop through this new exchange, right? There, as this gentleman mentioned, there are other options outside of the exchange that may be better for your specific situation. You can only, with that being said, you can only receive the tax credits through the shop marketplace. Okay, that's the only place you can go. So the insurance company will directly receive that money. And then, so for you, it'll already be reflected in that bill. And as a small business owner, I'll get to this in a sec, Sarah touched on employee choice. This is a great provision. I think it's one of the best provisions of the law, is you can have, think of like a vertical or horizontal employee choice, have a grid. On the left side, you'll have the insurance companies. On the top, you'll have gold, silver, bronze plans. You can actually set up a system where your employees can meet in the middle. I want the silver plan from Aetna, or I want the bronze plan from Connecticut, if you're in Connecticut. Or as an employer, you can just meet them in the middle, say, I'm going to offer this plan, that's it. This is one of the new provisions of the law that's great. So with that in mind, this is the place where you can receive those tax credits. So you will not be, with those tax credits will go into effect, you will not see those, but they will show up in your monthly bill. And it will be one bill no matter how your employees say there are 3 of them take 3 different insurers with 3 different plans. That'll be one streamlined bill that will go directly to the marketplace, not the insurer. So they will take care of all of that for you. So you'll be essentially seeing after subsidies.
But I still, if I go directly through, say, Oxford, then I just have to get that tax credit back on my tax credit.
Correct.
Okay,
Yes.
so it's just a question of funding that tax credit for it.
Exactly. Yes, ma'am.
The same thing as the rebate?
Yeah, so great. There's a lot of terminology going on here. On the individual side, we call them subsidies. On the small business side, we call them tax credits. So yes. So again, slow me down. Yeah.
Yeah, so you're saying that he, as a small business owner, would get that tax credit, or he as an individual would get that tax credit?
If you're applying through the shop marketplace, you as a small business owner would get that tax credit and then determine how to dispense that throughout the employees.
But if you're getting through Oxford,
Does Oxford offer in the shop?
Oxford offers in the shop, but the Oxfords, if you go directly through Oxford, their small group plans are
Yeah, so
superior to what they're
so the
offering.
non-shop plan, is there a tax credit?
no. Shop is the only place where you will be eligible for a small business tax credit. With that being said, if you look outside the marketplace, maybe there are some plans, a small group plan, that will be more cost effective for you. Again, if you do have fewer than 50 full-time employees, you do not have to offer health insurance to your employees.
As a not-for-profit, where is that tax credit specifically applied?
Yes, so nonprofits don't pay taxes. As she mentioned, starting this year, you'll be eligible to up to 35% because of the tax structure, as opposed to small businesses who may be eligible for up to 50%. That tax credit, so this is kind of get in the weeds with the tax professionals, will come it'll come in the form. I'm trying to figure out how to say this. At the end of the year, you'll get that refundable, right?
So we as a not-for-profit would pay the brunt for 12 months, and then at some point in the tax cycle...
Yeah, so you pay for health insurance. You would get this credit, and then with that credit being applied, it would then go, you could, what am I trying to say here? With that credit being applied, it would then go towards, however you want to disseminate that credit to the employees that you have. Is that? Yes. So that will go to the small business. So as a small business owner, you have a couple choices to make, right? So I'll get to the tax credits a little more in a sec, but you have 3 criteria to meet. Here, let's just go to those. Actually, this is an important slide. So the shop, again, is Small Business Health Options Program. Okay, so this is separate than the individual exchange. And I like to think of it as like an Orbitz or an Expedia. It's a one-stop shop where you can compare and contrast plans. Again, as this lady mentioned in the back, this is the only place that you can receive these tax credits, okay? And in most of the states out there, you have to have a broker that is certified to purchase these plans, okay? So, and there's a lot of monkey business going on out there too, that folks say, hey, I'm a broker, come, I can sell you this plan. You have to make sure they're certified. You can go on the website for each exchange and find a list of brokers that are in your zip code and that are also near you, your county, and it'll show you that information.
I'm sorry if I don't understand, but currently, prior to the affordable, you could get a tax credit. And so you're saying that you, with your, run your premiums, you pay the full year, and then at the end of the year you
Yeah.
apply.
So are you asking, but prior you could not, prior to 2010?
You could. I get a tax rebate every year
Okay.
based on my premiums, and so are you saying that you can no longer do that unless you go through shop?
So, great question. Through the Affordable Care Act, the government has set up these tax credits for small businesses, right? So if you are looking as a small business owner to provide, you want to purchase your insurance through the shop, you can still also do it on the individual marketplace, right? But if you think it's best to purchase through the shop, that is the only place where you will get the small business tax credit. Does that make sense? Does that answer your question?
Previously, we could file a 5498 when we filed our 990, and we could get credit for our health insurance.
That's what I'm.
So it's not at all parallel to that anymore. Now it's only if you get it shopped, and it's a whole different process.
As a nonprofit?
Yes.
Yes. No, that will stay the same. So we're talking about, so say again, most folks I talk to are these small businesses. If they choose to offer, if they're under 50 and they choose to offer to their employees, this is the place where they will receive that tax credit. So say you're just a small business, not a nonprofit, and you want to purchase through the shop, provide coverage to your employees, this is the only place you would go for that tax credit. Okay? And so the plans in the shop will be organized just the same way as they are in the individual marketplace. They will start at bronze, go up to platinum, and again, with employee choice, there will be a streamlined billing process where it doesn't matter how many different plans your employees choose and what different carriers they will choose to accompany those plans. It will be one streamlined bill that it's important to know will be you will pay the shop, not the insurer. So there are 3 criteria we were kind of touching on earlier that you have to meet in order to be eligible for these small business or nonprofit tax credits. Okay, so number 1, you have to have fewer than 25 full-time employees. What does that mean to be a full-time employee? You have to work more than 30 hours is what the law says. Part-time is 15 to 29. And then I know you mentioned in our call that there's also a seasonal provision. That's less than 120 days a year if you work. Now, there is a seasonal exemption. So if you are right on that cusp of being almost 50 employees, if the specific reason that you go above 50 employees is because you have seasonal workers, then you are exempt from being a large employer, which would mean you don't have to provide health insurance for these folks. Okay, so number 1 is fewer than 25 employees. Check that one off. Number 2, average annual wages of less than $50,000 a year. This is excluding the owner's salary. Okay, so if you have 10 employees, you take their 10 annual salaries, add them up, divide by 10, and that number is less than 50 grand. You can check that one off. Yeah.
That doesn't include the seasonal employee, right?
Correct. Oh, she asked, does that include the seasonal employees?
And the answer was?
It does not. So, sorry, go ahead. I'm sorry, I can't.
Nonprofits don't generally have an owner. They have an executive director and a board of directors. So in that case, does the executive director's salary?
Yes, the whole nonprofit would get added up into this equation. Correct. So if you have that number 2, if you can check that one off, this is number 2. And the last one, it's very important, is the employer pays at least 50% of the premiums, okay? So if you can check these 3 boxes off, then you will be eligible for a tax credit as a nonprofit or a small business owner through SHOP. However, will you be eligible for the maximum? You know, that's up to your specific situation. So these tax credits will go on a sliding scale. Starting in 2014, this year, for small businesses, it would be up to 50% if you met those last 3 criteria. Starting this year for nonprofits, it would be up to 35%. Now, this is important to know. It's for 2 consecutive years. This was a purposeful provision of the law. So if you take advantage of this tax credit in 2014, you'll also be able to take advantage of it in 2015, and then it stops. Decide to take advantage of it in 2016, the consecutive year would be 2017, and then it stops. So 2 consecutive years. Now, many of you probably work with tax professionals. I would encourage you to do that when you are going through this process, because this tax credit was available in 2010. And if you didn't know about this credit, you can go back and amend your taxes for 2010 and 2011 to take advantage of this tax credit for the past years. And again, for small businesses, it doesn't include cover premium expenses of owners and their families. So for 2 consecutive years, that's important to note.
So if we've already received the credit in previous years for 2 consecutive years, are we no longer eligible?
Nope, it's starting in 2014.
Okay.
Yeah.
You have done the old existing one for 2010 and 2013 if you were eligible?
Correct. It's still available. So this slide kind of touches on who's eligible, who's not eligible. We found that more than 3.2 million small businesses are eligible. I know specifically because I work in the state of Connecticut, I think like 25,000 businesses in Connecticut are eligible, and 13,000 of those businesses will be eligible for the maximum credit through the SHOP marketplace. Now again, a lot of you have, you have your own unique situations. I do want to emphasize that A, if you're under 25 or under 50, you don't have to provide health insurance. B, private insurers will be still competing for your business in the exchange and outside the exchange. So say you have 3 employees, 2 of which are part-time. If I'm coming to them as a small business owner or a CEO of a nonprofit, I would say, look at your options maybe outside of the exchange as well, because you would be eligible for financial assistance out there. With that being said, if you're a small business and you take advantage of the small business tax credit and you offer insurance to employees that meets affordable coverage, which is if it's less than 9.5% of their yearly income, if you offer that and that's affordable to them, and then they're like, nope, I don't want to take advantage of this, and they go outside of the exchange, they will not be eligible for an individual subsidy outside of the exchange if you take advantage of that tax credit and are offering them affordable coverage through the SHOP exchange. Does that make sense? Okay. Alrighty. So how do you claim this? For small businesses, 8941, which is on the IRS website. For nonprofits, it's 990T. And again, it applies as a small business towards your income tax, not your employment tax. So employee notifications should have happened by October 1, 2013. You are required by law to inform your employees about the new health insurance marketplaces. However, let's clear the air. There is no financial penalty if you do not, but it is a requirement. So I like to tell people, print off the model language that is on that website right there and put it in your employer handbook or post it on the cork board as folks walk in, because by law they are required to know about these new marketplaces. And there's 2 notices available. Again, one for employees who do offer and one for employers who don't. And again, it was Sarah and I talked after her presentation. It was important to note that what are the benefits for using the SHOP exchange, right? I mean, that's a question that everyone here probably has. For me, what we're seeing in our organization is the tax credit really benefits folks if you have around the 10 to 12, depending on your specific situation, but 10 to 12 employees. If you have like 3 employees, 2 employees, one of them's part-time, again, part of the Affordable Care Act is forcing folks to realize that they need to be informed consumers. So you really need to take a look at what's outside the exchange and also through the SHOP marketplace or in the individual exchange, because you have this chance now to compare apples to apples, all of these different health plans that are available. And to me, another benefit of shopping in the SHOP would definitely be employee choice. This has never happened before, where, especially in the Northeast, a lot of these states that I'm working in, where you can have 3 different insurers offering 3 different plans, and your employees can choose through those, and you'll have one bill that pays to the SHOP marketplace. And that's, that's, for me, the employee choice is a huge part of the small business piece. Which brings us to the employee shared responsibility requirement, which a lot of you may know as the employer mandate. This was delayed till 2015. Just to give you an idea of who this affects, 96% of all businesses in the United States have fewer than 50 full-time employees, okay? So this affects a very small chunk of the pie, but you do need to ask yourself some questions if you have 50 employees. So you need to determine and calculate how many full-timers you do. Again, 30 hours or more is a full-timer, 15 to 29 is a part-timer, and seasonal is less than 120 days per year. And I'm happy to get in the weeds with all of you on email or in person after this, because it does take some time to sit down and really look at how many hours your folks are working and adding all that up. So the size will be determined annually. The amount owed will be determined monthly. Potential requirements: if you fail to offer coverage, it's $2,000 for each full-time employee per year, excluding the first 30. And if you fail to offer affordable coverage that provides minimum value, it's $3,000 per year for each full-time employee receiving federal financial assistance in the marketplace. And again, to meet that minimum value, it means if you're offering a plan that exceeds 9.5% of their income, then that's deemed to be unaffordable. Again, where do you go? Well, if you're in a state with a federally facilitated marketplace, healthcare.gov, states like this: Georgia, West Virginia, New Jersey, Pennsylvania, and Virginia. Sarah showed you a couple of these. DC, Maryland have set up their own exchanges, as well as New York, State of Health. I can't believe they picked that name, but they did. Massachusetts, Connecticut, again, Access Health CT. Timelines: the marketplace is open for business. SHOP is rolling enrollment. So for the small business owners that are going to purchase through SHOP, know that it's rolling. Okay, if you're an individual, the open enrollment, again, March 31st is when it ends. And the employee notification, important to note, is also on an ongoing basis. But I know the media has done a crazy bit with this employee notification. There is no financial penalty if you fail to notify them. However, they should be notified. Okay, so some resources. On our website, you'll find our healthcare coverage guide. This is a step-by-step process tailored to small business owners and nonprofits to help them walk through this process. And please give us your feedback on it. We've spent a lot of time on it. There's always the SHOP call center. Again, the online portion is delayed till 2015 for those of you that live in federally facilitated marketplaces. That doesn't mean you can't enroll. You can still call, you can still fill it out, but if you want to do all that online, that portion is delayed till next November. States like Connecticut, New York, SHOP are up, they're operational. We're seeing some lower numbers on the SHOP. In Connecticut, there's only 14 businesses enrolled in SHOP as of now, but we're hoping that that number increases. Again, the whole goal is so small businesses can pool that risk together and then leverage their purchasing power, say like you're going to a business of 500 employees. So we're really hoping that small businesses see this, take advantage of it, because there are a lot of folks that are eligible for these tax credits. Interested in getting involved, Emma Hollister is our network manager. We have DC fly-ins every year where small business owners and CEOs of nonprofits such as yourselves come talk to the head of SBA, senators, congressionals, and they really voice those concerns that they have. So Emma would love to talk to you. I would love to talk to you after this if you're looking to really dive into some of the issues. It doesn't have to be healthcare, clean energy, tax reform, retirement security. So yeah, that is, I think, most of the presentation.